Yes.
Go within and ask, what do I need? Show me what I need. And if you want to get it quick, you say, beyond a shadow of a doubt, with grace and ease, please. Because if you don't add that, all kinds of weird stuff could happen. You can get it really fast, but might not like the way that you get it. It's not being activated. It's not being used by the cells because it can't be. It doesn't fit the configuration. It's a key that doesn't fit our lock, basically. Hopefully that explains it a little bit better.
No, that makes a lot of
So
sense.
yeah, so what you're looking for is, you got to find out what the cause is. And I know a lot of people are out there going, I don't have health insurance, and I just have to do this myself. Okay, that could be a problem when you come to deal with hormones, because hormones are little teeny tiny packets of information that go throughout the entire body. And if you mess with your hormones incorrectly, then you're going to start this whole cascade of problems throughout the body. So, I can't tell you what you have to do to go get something like this diagnosed because I only know about the United States. But the main thing is you need to know if you've got this particular problem, this autoimmune thyroiditis, then yeah, you got to deal with that. Okay. You cannot let it go.
This is the Wonder Network, where we discuss healthy options for humanity. I'm Michael Lane, and today with me is my co-host, Dr. Val. Dr. Val is a retired seasoned naturopathic physician and a registered nurse with over 4 decades of experience spanning various realms of acute care, including emergency care, intensive care, cardiac care, home health, and home hospice. How you doing today, Dr. Val?
Good, Michael. How about yourself?
I'm doing fabulous. I'm doing fabulous. What do we got? What do we got on the docket today?
Well, we had talking about autoimmune thyroiditis. And a lot of people have that now. So there's more to it than most people think. So I figured we'd start out with what is it? So basically, it's a condition with the immune system, obviously, autoimmune, and it's where the immune system starts attacking the thyroid gland, basically eating it. So it leads to inflammation, and then the gland gets damaged and can die. So, of course, that results in a decline in thyroid hormone production. And anytime you have less thyroid hormone than you need, that is hypothyroidism. Hyper is where you have too much. That's where you get into things like Graves' disease. But the exact cause of autoimmune thyroiditis is kind of mysterious. Nobody really knows, and they tell you, well, it's just an autoimmune disease. Okay, well, autoimmune diseases can strike pretty much any place in your body. So when that happens, you have to figure out, what am I going to do about this? Because that's not something that goes away easily. So, if you just are hypothyroid, then you're looking at some kind of thyroid replacement. But you need to know, what kind of hypothyroid is it? And hypothyroidism is extremely common in the developed nations. So US, Europe, Canada,
Interesting.
other parts of the world. Yeah, it's really, I would call it more the fatigue disease. So many people are so fatigued. There's a
Yes.
lot more into it than just, what medical science would have you believe, because we have so many things that affect us now. We have this 5G radiation, we have ionizing radiation, we have all kinds of crap in our food and our water, in our air. All of that stuff is working to make it really hard for our bodies to be normal. And I don't know about you, but I don't know anybody that doesn't have something that they have to deal with, whether it's a frank disease or an injury, or just general malaise. I don't know anybody that says, oh, I'm 100% healthy. Well, except
Right.
for maybe Dr. Group. He's a special case.
Yeah. Well, there's always exceptions to every rule.
Yeah. So for the rest of us, we spend sometimes a lifetime trying to figure out what exactly is the problem. And as someone myself who started out with a thyroid problem years ago and had borderline hypothyroidism for most of my adult life, it took some investigation to figure out, did I have this autoimmune disease? And a lot of people get this after getting the flu, by the way, or something like that. Or was it something else? And in my case, it turned out to be reverse T3. And so this is a whole other thing. We'll have to do a different segment just on reverse T3 if people want that. Because reverse T3 is kind of like it's kind of like the sweetener class, you know. When you look at sweeteners, there's sugar and glucose, dextrose, maltose, et cetera, et cetera. And then there's these sweeteners that mimic that, but they may be the same chemical configuration as the sugar, but it's reversed. So it's a mirror image. Same thing happens with thyroid hormone. So if you're producing the mirror image of T3, you've got a problem because it won't show up on the test unless you do a reverse T3 test. And we'll get more into the testing in a little bit, but this is something that's not commonly tested for. But what happens with that, what it means is you've got all this stuff, your thyroid gland is busy making all this stuff and spitting it out, but it's not being activated. It's not being used by the cells because it can't be. It doesn't fit the configuration. It's a key that doesn't fit our lock, basically. Hopefully that explains it a little bit better.
No, that makes a lot of
So
sense.
yeah, so what you're looking for is, you got to find out what the cause is. And I know a lot of people are out there going, I don't have health insurance, and I just have to do this myself. Okay, that could be a problem when you come to deal with hormones, because hormones are little teeny tiny packets of information that go throughout the entire body. And if you mess with your hormones incorrectly, then you're going to start this whole cascade of problems throughout the body. So, I can't tell you what you have to do to go get something like this diagnosed because I only know about the United States. The rest of the world, I don't know what you're going to do. Okay, I'm sorry. But the main thing is you need to know if you've got this particular problem, this autoimmune thyroiditis, then yeah, you got to deal with that. Okay, you cannot let it go. So now we'll go back into the cause. Okay, they don't know the exact cause. I've told you a few things that can cause a problem, but they think it's triggered by kind of a combination of both your genetic factors and the environment. And my money's on the environment, really. There's very few that really genetically have that problem, unless, I haven't seen the latest statistics on it, but, I could be wrong. It can happen. But basically, this is something that I think is really more attributable to the environmental factors, principally hormone disruptors. And that would be things that are in our foods mostly, but also in
Yes,
the environment. There's all kinds of poisons and toxins everywhere now.
everywhere.
Yeah.
Yeah.
So, probably more environmental. And I've noticed there's a huge uptick in people with autoimmune thyroiditis.
Yes.
So then there's the genetic part, and the more normal stuff is that people are more likely to develop it if they have a family history of it, are female, or have other autoimmune disorders. And as I said before, it's not easy to backtrack out of an autoimmune disease. You can, but it takes usually a couple years. And it takes some really serious work on the part of the patient to make sure that they're avoiding all of those things that can cause these problems, and also that they're taking whatever it is that they need to be in a good state of health. So now let's go to the types. There's 3 types of autoimmune thyroiditis. Hashimoto's is the most common type, and the one that you mostly hear that people are like, oh, I got diagnosed with Hashimoto's.
My,
Okay.
my oldest my oldest daughter has Hashimoto's.
Yeah. Well, there you go. Destroyed thyroid by the immune system. So it's like your immune system recognizes the thyroid hormone as the enemy. And that's why this kind of stuff is happening. So, what pushes it over the edge? They don't really know, unfortunately. Hopefully, they will find that out at some point. But it is caused by your immune system. So, if you have a chronically inflamed condition in the body, and if you have all of these other factors, then that could push you into something like this. Okay, then there's chronic lymphocytic thyroiditis. So that's a type that affects the thyroid gland and causes hypothyroidism. Again, lymphocytic has to do with the lymph system, and it's chronic. So this is one reason why most natural health doctors will tell you you've got to knock down the inflammation in the body. Stop these inflammatory chemicals that the body is sending out that creates further problems. Okay, and then autoimmune thyroiditis specifically is a general term, and that means any type of thyroiditis that is caused by an immune response. So now we'll go to the symptoms. Now, these are very common, very general symptoms, but these are what are kind of the hallmark symptoms of a hypothyroid condition. However, these are general, okay? You can have this happen with other diseases too. This is why you kind of need some kind of testing. So fatigue is the first one. Unexplained weight gain because your metabolism is slowed down. So thyroid keeps your metabolism going at a good pace to do everything it needs to do. Dry skin, cold intolerance, hair loss. Now, this is not the common hair loss of aging, although it can be. If you've got a hypothyroid condition and you're aging and you go through menopause or andropause, and all of a sudden the hair starts falling out, it could be hypothyroid. So it's common to test people past a certain age for hypothyroid conditions. Another one that's not noticed so much is muscle weakness and depression. If somebody is really hypothyroid, they will get extremely depressed, and memory problems. So again, these are general. Like most people are like, I have all those symptoms. Yeah. Yeah. Welcome to life on planet Earth in 3D
Yep.
in 2024. Yeah. So a lot of people have these things now. So basically, yeah, I'm sorry, it's depressing.
Well,
Oh,
and I've noticed there has been a big uptick, since our COVID. Dare say the V word.
yeah.
Yeah, that there's been a big uptick I've seen in autoimmune diseases. Yeah,
Oh, yeah, of all kinds. And we'll cover more
yeah.
autoimmune diseases, as we go through with all of these videos. Okay, so now let's talk about the complications. This is if you leave autoimmune thyroiditis. I have to say that slowly because it's a tongue twister. If you leave that untreated, it can lead to some pretty serious complications, such as thyroid lymphoma, hypothyroidism, and hyperthyroidism. And any of those things can kill you, some slower than others, but this is something that, if you think you're hypothyroid, go get it taken care of. There are natural things that you can do. And I can tell you, as someone who has suffered with a reverse T3 syndrome, I have to every so often go through doing a couple things myself. And there's one thing that I did that actually worked, but just look up Russian thyroid cure. That's all I'm going to say. Okay. I am not
Russian.
going to
What?
go
What?
into it.
Can you repeat that? What? Look up what Russian what now?
Russian thyroid or hypothyroid cure.
Okay.
It's actually a cure for both types, but
Okay.
yeah, it's quite interesting. And people thought it was totally crazy, but I did it and it worked. But I'm not going to talk about it here.
Okay.
It's fairly easy to do. But, first, you really kind of need to know where you're at because a lot of people are not good doctors for themselves. I've had patients like that. And I have had to absolutely forbid them from treating themselves because they're idiots. I'm sorry, but
Yeah.
they are not good doctors. They take a little bit of something that they've heard, usually from somebody who's pushing supplements. They'll
Right.
take they'll take that, and then they'll think that that's what they've got, and that's what's going to fix it. Oh my gosh. I could tell you stories about what people have done to themselves that I had to fix that just is really aggravating. So I started giving people the lecture, in the first meeting. I would say, if you continue to insist on treating yourself, I may fire you as a patient because this is just too frustrating for anybody to have to deal with, because then they come and they yell at you if something doesn't work.
Right.
And then you sit them down and you find out what actually did they do. Well, what they did was stupid, you know. So, I mean, I'm all for people learning to help themselves, but there are some instances where you really need more professional help to deal with whatever it is that you have. And just asking your friend or neighbor might be helpful, might be not. Depends on
Right.
how good a doctor they are, you know? So, with this kind of stuff, you could feel 100% better if you just get the treatment that you need. And in many cases, you can actually reverse some of this autoimmune stuff. But like I said, it takes a while. It takes some concentrated effort. So, how do you find out? The standard thyroid function test is what you do. That's the TSH, T4, and T3. And as I said, they don't test for reverse T3. So you have to ask for that specifically. And I'll go into that when we do another segment on thyroid, but just know that it's a mirror image. Your body can't use it. So if you're making a lot of it, that's a problem because T3 gets converted to T4, and that's what you need to have happen. So if you have reverse T3, it does not get converted to T4, and then you're hypothyroid. So, yeah, I could be the poster child for that. We'll talk about that when we just do a show on thyroid. Okay, so then you also want to check the anti-thyroid antibodies, which is TPO and or TG antibodies. And then you want imaging studies, ultrasound or CT scan to rule out other conditions. And you also want to make sure that the physician is actually grabbing you by the throat and palpating. So they will normally stand behind you or off to the side, and they'll feel your thyroid for nodules, or for like one side could be bigger than the other, or it could be practically non-existent. So if they're not laying their hands on you to do that particular test, um, all I can say is I've had patients that asked me what I was doing when I was doing a physical exam, and I'd say, I'm doing a standard 72-point Western medical physical exam. And they'd say, I've never had that done before. And I look at their records, they've got a ton of records. And all these doctors that wrote this whole thing, a history and physical, and it turns out they never actually touched the patient.
Wow.
No wonder they can't heal anybody. We really need to be advocates for ourselves. You know, we really need to pay attention
Agreed.
and make sure that the doctor's doing what should be done. And if they tell you, "Oh, I don't need to feel your thyroid," go find another doctor. Because if they're going to be that lackadaisical about it, yeah, you don't want them. Okay, now we'll get to the conventional treatments. So that usually is fairly simple. They just replace the missing thyroid hormones. Now, if you're going to an MD or a DO, you're likely to get synthetic. That's levothyroxine. And if you go to a naturopathic or chiropractic or an OMD, Oriental Medical Doctor, homeopathic doctor, you're going to get something different. Now, in some cases, surgery might be necessary. You might have to have a portion of the thyroid gland removed, or they might irradiate it, to stop it from whatever errant activity it's doing. And now we'll go into the Chinese medicine. And well, not just Chinese, but acupuncture works very well along with Chinese medicine to help with this. It's a holistic approach, like a naturopathic approach or a more chiropractic approach. So the main goal of that is to actually balance the body. So you want to make sure all of the energy in your body is going through your body the way that it should. So Chinese medicine and acupuncture really helps with that. They also have herbal remedies that can help you with dietary changes. Um, I am a big fan of acupuncture, and not only for myself, but for my patients. I used to do quite a bit of acupuncture, and it can alleviate a lot of symptoms fairly quickly. So, yeah, that's a good thing to do. Okay, you might want to consider iodine therapy,
Oh, really?
especially if you
Hmm.
right, yeah, if you live away from the ocean, then
Yeah.
yeah, you're going to need some iodine. And with the oceans now being pretty much polluted, a lot of people used to eat a lot of fish. I used to. Of course, I lived on the West Coast, so fish was common at least 1 or 2 days out of the week. And, we had good fresh fish. But if you're inland, first of all, how fresh is your fish? If they flash freeze it, then, it's okay. And normally, you're going to want to eat shellfish for the iodine. So people that are allergic to iodine, they can't eat shellfish. Can they take iodine? Sometimes. It depends. And that's something that you really need a physician for. I had one lady that got myxedema from hypothyroidism, which basically means that her tongue swelled up. And it was the biggest swollen tongue I have ever seen.
Oh, wow.
Yeah. And so I put her on iodine along with thyroid. And she said that she was allergic to it. And I said, well, you can't be allergic to thyroid. You could be allergic to the thyroid medication. And so I put her on the natural stuff because I asked her, well, can you eat shellfish? Oh, yeah, but I can't eat a lot of it. Okay. So I told her to get some Benadryl, and the pharmacist says, man, you're pretty brave to do this if you've got these allergies. And, you have to talk to somebody to find out if they have real allergies or if it's just something weird that happens with something else. And
Right.
that was her case. So, I mean, that tongue was so big, it was actually blocking her ability to breathe through her mouth, which is
That's
not a
scary.
good thing.
Yeah.
Yeah, it was really scary and weird looking. So I got her on the stuff and, took care of it. She was severely hypothyroid and untreated. And so that's one of the things that can happen. But iodine is essential for your thyroid to function. So what are you going to do in that case? You're going to get a doctor to help you. Okay.
Unlock your natural healing gifts and transform lives. Are you intuitive, compassionate, and driven to make a difference? The Wonder Network offers you a path to turn your calling into a fulfilling career in the healing arts. Imagine helping others while building a rewarding profession, all within 60 to 90 days, and we even have payment plans to help get you started. Our holistic health training courses empower you to develop your unique healing abilities, start earning while you learn, join a supportive community of like-minded individuals. Ready to embrace your true potential? Click now to discover how the Wonder Network can guide you towards a meaningful career in holistic healing. Your journey begins here.
So it can help with autoimmune thyroiditis. But again, there's precautions. So not everybody can take that. Okay, then of course there's naturopathy as well, which is a holistic approach. Combines the natural therapies with lifestyle changes. So basically, you take out the foods that would tend to make the thyroid not work so well, like cabbages. And in fact, I've used heavy cabbage juice and things like that, big doses of cabbage to knock people down when they've been over medicated. Because with hormones, it takes at least a month to see any improvement with the medication, and it's going to take up to 6 months to get it knocked down if you've been over medicated. And I've had a couple patients that were over medicated as well, because their doctor just kept giving them bigger and bigger doses of thyroid hormone and got them into trouble. I just shake my head with some of this stuff. What
Yeah.
else can you do?
Yeah. What else?
But yeah, so I would put them on a lot of cabbage. I'd say eat cabbage every meal and get cabbage juice. Drink that cabbage juice because it will bind the thyroid hormone. And I would get them out of their serious condition within a month instead of 6 months.
Right.
So if you are somebody that's hypothyroid and you love cabbage, stop it. Find something else. Okay. So that's my major tip for the day. Cabbage can cause a problem. Okay, then you've got homeopathy, which naturopaths also do, by the way. Some of the homeopathic remedies are constitutional, which means that that's for your particular body type. So usually a homeopathic doctor is going to give you an interview. It's going to take a couple hours, and they ask you a bunch of really bizarre questions, and then they pick out what remedy they think is going to work for you. And that is quite effective, especially in reversing things like autoimmune disease. So if you're not familiar with that, you might want to check that out. Again, it has to be a doctor. So it's either a homeopathic doctor, which would be MD and then parentheses H, or a naturopathic doctor. I think some of the other disciplines are now starting to include homeopathy, but you'd have to check and see. So some of the homeopathic remedies might be used just to support thyroid function. And it all depends on, when you started with the problem, what caused it, et cetera, et cetera. Massage therapy can help because it helps to reduce the stress and promote relaxation. So that can help. And it can help to relieve also deep tissue can help to relieve some of the crystallizations that happen along the nerve roots that cause some of these problems. I know it sounds weird. Nobody's ever heard of crystals in nerve roots, but it's called a crystallization because you can press on the nerve and it feels like it's hard and kind of crunchy. And usually if you do that, the patient is going to scream. You may have to peel them off the ceiling because it feels like ground glass.
Ooh.
And yes, been there, done that. Yep. I know both sides of that one.
Ouch.
But it hurts. But if you keep pressing on it and you break up those kind of crystallized nodules, then it helps the nerve to function better. So there's all kinds of things you can do to help with that too. I know it sounds strange. You want to know strange or weird, ask me. I've got plenty of strange and weird things. And I mean, things that I've done to myself and to other people that have worked. And, use your intuition too. I think intuition is one of the biggest things that can help. Ask what we call the highest self or your inner spark of divinity.
Yes.
Go within and ask, what do I need? Show me what I need. And if you want to get it quick, you say, beyond a shadow of a doubt, with grace and ease, please. Because if you don't add that, all kinds of weird stuff could happen. You can get it really fast, but you might not like the way that you get it.
Right.
So yeah, that's it's one way to do it. Be careful.
Be careful. Yeah. Be careful. Yeah. What you ask for. In other words. Yeah.
Yeah, absolutely. Be very careful because that can help you. And normally, like what happens with me is I get woken up like at 3 or 4 o'clock in the morning. And this thought, that used to happen to me with patients all the time. And I'd be like, do you have to wake me up at 3 or 4 o'clock in the morning? Seriously? When I'm asleep, I want to stay asleep.
Right.
So
So
yeah, so do include your intuition in that. Okay, then functional medicine. Have you heard of functional medicine, Michael?
I've heard the term.
Mhm.
I don't know if I know the definition a lot, but I am aware of it.
Yeah, a lot of people are kind of in the same boat. Functional medicine is amazing because it's a holistic approach that focuses on the identification of the underlying problem. So it's looking at the imbalances and deficiencies. And a lot of this stuff can be traced back to just simple nutritional deficiencies because we no longer have the things in our food that we need, like selenium and iodine.
Right.
So, and zinc, there's a lot of things that we're missing in our foods because of modern agriculture. And, it used to be that bodies got recycled too, like animal bodies, they got recycled. For instance, silver. Everybody's taking colloidal silver now for infections and things. Well, silver used to be in our soil because it was in the bones of the animals that then were ground up and thrown into the compost or thrown on the garden, especially around tomatoes and things that needed calcium. So if you no longer have that in your food, where are you going to get it from? Well, supplements.
Supplements. Yeah.
Yeah. So, at least nowadays we have things like that we can get. We don't have to do it all ourselves. So basically, with functional medicine, they understand better how the body works. And that's something that's lacking in most of modern medicine. They seem to think that the organs are in separate little vacuums by themselves, but they're not. Everything works together. So if you don't have everything working together, you better figure out what the problem is,
Yeah.
because it starts a domino effect. Things start to just crash over. And then pretty soon you get to the end point where there's nothing else working. And at that point, you're out of here, you know? So, yeah, functional medicine is great. So, a functional medicine practitioner is probably going to use a combination of conventional and alternative methods, like a naturopath does. So, you got to address that underlying problem. This is why I'm so big on, pushing that. You got to find out what it is first
Get to the root
so
of
you
it.
know how
Yeah.
to treat it. I mean, it's common sense to me, not so much common sense to other people, apparently. So, yeah, our body parts are not in a vacuum. They're all working together. It's a synergistic thing. So keep that in mind, especially with a hormone imbalance, like with
Yeah.
autoimmune thyroiditis. Okay, then you can also go to Ayurvedic medicine. Now, that's a very ancient system of healing. I usually hear about it from people that are from India.
Yes.
So they, again, are looking at balance and harmony in the body. And they use a lot of terms that we're not familiar with. And they use a lot of herbal remedies, dietary changes, lifestyle modifications, and things like yoga and meditation. And by the way, you can use meditation to heal your body. So a lot of people say, "Oh, I don't have the time. I can't really get into it. It doesn't work for me." Well, figure out how to make it work.
Yeah.
I'm not known for mollycoddling patients. It's like, figure it out. It's your body. Do you want to get well or not? If this is something that's going to help you, if you've got a very stressful lifestyle and you don't have some form of meditation going, you're asking for trouble.
Right.
So figure it out. So those are the main things that can help with the autoimmune thyroiditis. And yeah, it's a big thing. It's going to take a couple of years to reverse it, as long as it's not, too far gone. If your thyroid's completely gone, then yeah, you're going to have to take thyroid medication of some type. Now, alternative medicine uses a combination of T3, T4, or natural thyroid, and synthetic thyroid medication is just T4. So, what's going to work for everybody? I don't know. You got to figure out what the cause is first and look at all of your symptoms. Look at what else is going on. Look at the tests. And yes, you do need the tests. And you never know, I mean, I had one lady that had a goiter. Now she'd had this goiter, it's like a big swelling. It's like the bullfrog neck,
Okay.
very common in the Midwest because they don't have fish that has iodine in it.
Right.
So until we got more into the more modern relief of medical symptoms like that, it was very common in the Midwest. So she'd had this for a long time. And she came to see me, and I was doing my standard 72-point Western medical physical. She had been going to a colleague of mine, and he just kept giving her more and more insulin. And she was diabetic, and she told me how much insulin she was taking. I said, "My God, nobody needs that much insulin. There's something else going on." And so I was doing my exam, and I looked in her mouth, and she had all broken, rotting teeth. I said, "Oh my God, you cannot get your blood sugar down until you get rid of those broken, rotting teeth. Because anything in the body that causes a stress reaction to your adrenal glands is then going to cause a release of glucose by your body because it's a stress response, and the body is trying to give the rest of the body what it needs to heal. But if you've got a complication like broken rotting teeth going on in your skull, you've got a problem that's not going away.
Yeah.
So that causes more and more problems." And she said, "Well, I can't afford to see you and go to the dentist." I said, "Go to the dentist because I'm not going to be able to help you until you get those teeth taken care of." So she had all her teeth taken out and got new choppers. She came back 6 months later, and she didn't have nearly as much need for insulin. So I talked with her about the insulin thing too. And I said, your need should decrease as those come out and as your body clears the poisons that have been put into your system from that. And so, yeah, she was at a lower dose, but then we really tackled it after that. And I said, "Can I test you for your thyroid?" And she said, "No, I can't afford that on my insurance." So then she went to work a couple months later, went to work at a different place, got really good insurance. And then she came back, she said, "Okay, now we can test the thyroid. I have really good insurance." I said, "Okay." So I did a whole passel of tests. I did tests that most MDs have no idea how to interpret, including the ENT guys. And, and so I did this test, that one test that was it was sky high. And I didn't know that because I hadn't seen the test yet. And I was out shopping, and I get a call on my cell phone from the ENT that I had sent her to, the ear, nose, and throat guy. And so he says, "This is amazing." And he said, "This test is like sky high. It should be like zero, and it's like 20,000."
Hmm.
And I think it was the TPO antibodies. And I said, "Okay, so what does that really mean?" He said, "I have no idea." He said, "You've done some tests I've never even heard of." And he said, "What made you think to do that?" I said, "Because I get all these weird people that nobody can fix." And so I was like, "Okay." So I said, "All right, you need to go to the endocrinologist and see what the endocrinologist says." And he was a young guy, looked like he was like 15, but brilliant. And maybe it's my age talking, but he was a brilliant guy. And so she comes back and she says, "Well, he wants to take a biopsy, but I don't think I'm going to let him do that." I said, "Do it." She was like, "What? I wouldn't think that you would want to do that. You're a naturopath." I said, "I'm a doctor." And she said, "Well, why do you think I should do it?" I said, "I know he looks like he's 15, but he's really brilliant. And I found him through referrals from other colleagues. So I know this guy's brilliant." And I said, "So if he thinks that you need a biopsy, I think you ought to let him do it." And she said, "Oh, okay." So she went and had the biopsy done. It came back as a brand new, highly aggressive form of thyroid cancer.
Oh, wow.
Yeah. And it would have killed her fairly quickly. And so she said, well, it didn't come back like that first. So what it first came back as was unspecified. And so I talked to the endocrinologist, and he said, it's not cancer, but I don't know what it is. And he said, so I ran it past these two pathologists. And he said, between the three of us, we've got like 150 years of experience, and we've never seen anything like this. And so I was like, huh, okay. And then I talked to the patient. She said, well, he wants to take it out, but, you know, I don't think I'm going to do that. And I said, no, do it. And she was like, what? You're a naturopath. I thought you were against surgeries. I said, no, I'm against unnecessary surgeries. So I said, it sounds to me like you really need to get this taken out. And she said, why? I said, because you've got 150 years of experience there. These three guys have never seen anything like this. That tells me that this is a problem. So I said, go ahead and have them take it out. Well, it was wrapped around one vocal cord, so they had to take out the vocal cord too.
Oh, wow.
And then they found out it was a highly aggressive, brand new form of thyroid cancer.
Hmm.
So this is the kind of stuff that can happen if you don't take care of these things.
Right.
So just throwing pills at somebody is not the answer. You know, she had people throwing pills at her for the thyroid condition for years. That was not the answer. So, yeah, that saved her life. So, do I think it's important to get testing? Yes, I do.
Yes. Yes.
And, you know, if you don't like the opinion of your doctor, go find a second one.
Yep.
You know, ask other people for referrals to doctors that they like with whatever it is that you're dealing with. Like I said, when you're dealing with thyroid, that's hormones. Hormones are serious. They're tiny, tiny, tiny little packages of information. And they're extremely important, and they go all over the body. And if you have a thyroid problem and you're going hypothyroid, like with Hashimoto's, then you are not living. You know, you have no energy to participate in the good things in life. So people will waste what energy they have working because they have to, but they're not enjoying it. They're dragging themselves through the day, and they're just not doing the things that they would like to do. They become recluses. You know, they don't want to go out and party. They don't want to go to dinner with friends. They don't want to go to the movies. It's too much effort.
Right.
That's hypothyroid. Okay. So,
Well, and I'm aware of some of that, like I said, because of my daughter. I haven't
yeah.
Hashimoto's, so I know she's dealt with it pretty much her whole adult life. I know she takes iodine. She's taken
Mhm.
iodine supplements. She said that does help.
Mhm.
And she has a prescription. I don't know. I was trying to think here while you're talking, but I don't know what it is. I forget what she's mentioned it to me, but I don't remember which one it is she's taken. But she's dealt with it pretty much her whole adult life, and she's a very clean eater. She's very health conscious.
Mhm.
She's a clinical nutritionist on top of everything, many other things she does. But um,
Mhm.
she has quite a bit of experience in dealing with the Hashimoto, and there's times
Yeah,
it does it kicks her ass, and
it does.
and then there's times where she feels great. It's a roller
Yeah.
coaster. And she's
Well,
also
yeah.
noticed it's changed where she lives. She's kind of moved around in different areas of the country, and
Uh-huh.
that has affected it also.
Yes. Environment. Yep.
Yep.
Yep. Yeah, it's a tough one. You know, anytime you have not just thyroid, but any kind of hormonal imbalance, it's tough. You know, it can take months to find the right combination for somebody to
Right.
where they actually feel like life is worth living. You know, bad end of it, you go into severe depression and you don't want to live. And, you know, the other end of it, you know, if you get into hyperthyroidism, then, you know, you become manic.
Hmm.
And that's not good either.
Yeah.
Nobody wants to be around you if you're manic. Boy, I've known a couple people in my life that had the manic stuff going on, and oh boy, I try to avoid them. They make me tired just watching them. You know, So, yeah, it's tough. Do you have any other questions, Michael, or anything to add?
I don't for now. There's a lot. And like I said, my experiences with, like I said, my daughter with the Hashimoto stuff, the functional medicine I find intriguing. So basically, with functional medicine, just to recap a little bit, they kind of focus on trying to get at the root of the problem, the root cause.
Yeah.
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 It is basically
So do naturopaths.
Yeah.
Yep.
So do naturopaths too. So it seems
Yeah.
that, very similar there. And when you're talking about, Ayurvedic, and going through, what they deal with. And I've done a little bit of Ayurveda stuff with some other stuff. And I know a lot of their treatments based on what, I don't know if people know that about your dosha, which is your body type. And I know you got to take,
Right.
you take, there's a certain test you go through to figure out I forget there, because there's three. You got Kappa, and I forget the other two.
Kapha,
Yeah. And
Kapha,
then,
Vata, and Pitta.
yeah, and PETA, yeah. And then based off of those is what steers you in the right direction to go for getting,
Yeah.
doing natural treatments. So, and I find that for in my case, times I've used it, very helpful. And I do like the Ayurveda method, of dealing with a
It
lot of
works
things.
really well for some people. It doesn't work for me, but I'm kind of odd, in case you haven't figured that out by now.
Well, and that's where, I've learned, because I'm a nutritional health coach as well. And, the one thing we were taught is everybody's different.
Yeah.
There is no, one size fits all thing in
Right.
food, in diet. And I believe that to be with even in medicine or anything. So everybody's like you've stressed here, you gotta kind of use your own intuition and figure things
Mhm.
out a little better yourself. Even with allopathic doctors, when I've gone to them, I can tell they rely on me, what I tell them. They're going to base their diagnosis a lot on what I tell. I got to tell them what I'm feeling, what's going
Yeah.
on, and you got to be as accurate as you can there. Otherwise it kind of messes up their diagnosis. So everyone's
Yeah.
different, and which means, treatments. Everybody's treatment's going to be different. So I think that's kind of
Yeah.
the biggest thing with a lot of things of getting in the health industry and getting treated for stuff.
Yeah. It is really, and I can tell you too. I have people calling me all the time, telling me, "Oh, I've got this going on, I've got that going on," and then, I start asking them the questions, and they leave out half of the information, and they're a couple states away.
Yeah.
And then I find out later that they had something completely different, and they just didn't bother to tell me all of these other symptoms that they
Exactly.
had.
Yep.
And I'd be like, "Well, what do you expect me to do over the phone? I can only go on what you tell me." And, I went through that with my sister. She told me she was having an allergic reaction. And so I told her to go to urgent care, and they found out she was having a heart attack.
Oh, wow.
She kind of didn't mention anything like
Kind
that.
of left that out a little bit. Huh?
Left out that whole thing. And I was like, oh my God,
You
and
could have led with that.
yeah. Well, no, she really thought she was having an allergic reaction, but that's common with women. At some point I'd like to do a thing on heart attacks in women, because they're completely different than what happens with men. Most women have what we
And when
call
we do,
silent heart
I
attacks.
can dip in there. I haven't had a heart attack,
Mhm.
but I have had angina, and
Yeah.
and I've had to have a stent. I do have a stent in my LAD,
Yeah.
which is rare, as I've been told, and I'm sure, as you know, because the LAD is very it's a bit off topic here, but the LAD is, our main artery, and as many nurses told me, it's nicknamed the Widowmaker.
Yeah, that's where my sister had her stent placed too.
Is it?
Yeah. Yep. Same thing. And a lot of that can be avoided by cleaning out the system, and making sure that you don't have plaque in the arteries, and yada yada yada. That's for
Yep.
several other shows.
Yes.
But yeah, so the things that you feel might be different person to person. And that's a big one with heart attacks. Women do not normally have heart attacks the same as men. Men are they're classic, textbook stuff. Women have a lot of silent heart attacks.
I was going to say men
because
are a little more violent, aren't they?
yeah,
Usually,
well,
yeah.
and you tend to notice it because you have more muscles, and
Okay.
because of the more muscles, you're needing more of a blood supply. And that's the quick, easy explanation. But I can tell you that I've had several heart attacks, and I had combined heart attacks and strokes due to a low oxygen status that I didn't know anything about. And I can tell you that I didn't even feel them.
Huh.
The only thing that caught my attention was when I passed out.
That would get your attention. Yeah.
Yeah, and I thought that's weird. It was light when I remembered, and now it's dark. Like, what happened?
Who turned off the lights?
Yeah, and yeah, I mean it's a miracle. I'm a walking miracle, basically. If I didn't pay attention to all of this other stuff and have clean arteries and that kind of stuff, then it could have turned out a whole lot worse. But I have come back from all that stuff using naturopathic medicine. So, you know, I guess one of my standard um, quotes that applies to me is "been there, done that." So
There you go. Yep. I
I
like
learned to
it.
be a better doctor because of it, really. But nothing was normal. But I was already aware that women have a lot of silent heart attacks. So, and that, by the way, hypothyroid and hyperthyroid can both cause that.
Oh, really?
So, yeah, if it's untreated.
Okay.
So, you really have to pay attention when you're talking about thyroid. It's not an innocuous little gland, it's important. It has everything to do with our metabolism. Okay,
Well,
that's
that's
all
some
I
good
have for
stuff.
today.
Well, that's some great info. I think because, like I said, this is a popular topic because it's increasing. I mean,
Yeah,
that's what's crazy. I mean, in our modern world, I mean, I can't tell you how often I'm coming across more and more people that are getting autoimmune disorders
yeah.
later in life, at all stages
Mhm.
in their life. It's just rampant. It's just coming out of everywhere, and there's not a lot of rhyme and reason to it. Although you can deduct a little bit of rhyme and reason, but that could be another show in itself. But yeah, I mean, I think this is something people have to be aware of, and I think this is a good start for people, a good show to get people started. Where to go? So that
Yeah.
being said, I will sign us off. This is the Wonder Network, where we discuss healthy options for humanity. I'm Michael Lane with Dr. Val. We will see you next time.